In my overview video of the American Society of Hematology annual meeting, I identified 5 key areas of research in multiple myeloma. Let's dive into area number 2, frontline therapy. To learn more about the other areas that we're exploring from ASH, please subscribe to our YouTube channel and you can learn about the other 4 areas that I highlight. We know that what we do as first-line or frontline therapy for multiple myeloma patients has a really important impact down the line on the time in remission and indeed their overall survival. There's been a strong trend over the last couple of years of moving from 3 drug combinations to 4 drug combinations or quadruplets. At ASH this year, we learned a lot more about these quadruplets. Interestingly, we saw them both in patients who are eligible or going to a stem cell transplant, as well as those that are not going to transplant. And what we're learning is that we get patients into a deeper and a more durable response. The German GMMG study demonstrated to us that 2/3 of patients with a quadruplet therapy of isatuximab, bortezomib, lenalidomide, and dexamethasone, and a single autologous stem cell transplant can achieve MRD negativity or minimal residual disease negativity in 2/3 of patients. These are the kinds of numbers that we've not seen before. But not only does it provide a depth of response, it provides a duration or a durable response where that lasts for a very long period of time. And so with this study, with the IMROZ study, with the Cepheus study, with the Perseus study, these may be funny words to you, but these are all large clinical trials that compared 4 drugs to 3 drugs. We're seeing a consistent trend of the benefit of quadruplets over triplets. But before I close off, before we think that it's all about more is better, we also ironically had a study that demonstrated that in some situations, less is more, and that comes to the 4th drug that we use in these combinations, dexamethasone. Dexamethasone is the drug that we kind of love and hate. We love it because it boosts the effect of other drugs, but we kind of hate it because as people stay on it, it causes a lot of side effects and can affect people's sleep and blood pressure and blood sugar and all sorts of other things. One of the French trials presented giving dexamethasone for only 2 months at the start of someone's treatment and then discontinuing it. And I think this speaks to the importance of what I call the down with dex movement, where we realize that dex can be very helpful at first, but then we can dial it down in the dose and even discontinue it. And we hope that this will now be implemented in other clinical trials as we go forward. So great things are happening in multiple myeloma and in particular in frontline therapy.